So, good morning. Today I am going to show you one important topic, calcaneum fracture. In this, I am going to tell you that what kind of excision you are going to put and how we are going to fix the fracture. In this, we are going to fix the fracture through the lateral extensile approach, and we will create the flap. In this, most important things you have to remember to protect the lateral calcaneum artery, and second most important thing for the fracture reduction, to make a window in the lateral part of the calcaneum and then reduce the joints, and after that you can put the plates and screws. So in these videos I will take you through the incision, steps of the fracture reductions, and how to put the plate.
So this is the tip of the fibula, and this is the posterior border of the TA tendon. Here we are going the peroneus tendon. This is the sural nerve, and this is the lateral calcaneal artery. This is the most important things which we have to preserve during the surgery. And mostly we keep the dissection between anterior 2/3 and posterior 1/3, or from the down the same like distal 2/3 and proximal 1/3. And we'll take a full incision and we'll raise the flap. And once we'll start, come back to you. So now I have given the incision, and now we'll go to the deep dissection to raise the flap until we reach to the bone. Here you are very safe, but when you go upward, you have to take care of the artery. Now I'm reaching the bone here. Deep knife, deep knife. More, more. So just you have to do the stay closer to the bone.
So after the incision and creating the flap, now you expose the lateral part of the calcaneum, and I'm going to see the facet for the flexor hallucis longus tendon. Can you retract this please? So you can see this is the facet
Better to stay below
for
the
the lateral
tip of the
aspect, and now I'm going to put the 3K wire, one in the fibula, another one is the neck of the talus, and the third one is in the cuboid, to use the no touch technique for the flap.
Slowly you have to going to raise the flap. So once I raise the flap, then I'll come back to you. So now we have raised the flap. We remove this lateral cortex, and I have reduced the sustentaculum thalli. You can check in the CM.
So after putting the crisscross screws, we have put the lateral calcaneum plate, and you can see that the lateral cortex of the calcaneum is also under the plate, and this is the facet for the flexor hallucis longus. And now you can check on the x-rays, you can check the crisscross screws and the calcaneum plate.
Now I'm putting this
Fracture is well aligned and polar angle is well maintained.
to hold the
So
fracture.
now the plate is in
There is
situ,
one
and I'll
transverse
remove the
fracture here,
K-wire
so
and
which you are
close
going to
the
hold from these screws.
flap.
And another screws we have already put under the sustentaculum thalli. So you can see on the CM. So now I'm closing the full thickness flap.
I'm putting the stapler here. So generally we have to avoid this area to put the stapler, but we are struggled for the plate arrangement as we have only one plate. So that's why it took a little bit more time. We have to cut the plate according to the geometry of the calcaneum. Now we'll do the dressing after the closure and we'll immobilize the patient after 6 weeks.
So thank you to watching this video. For more surgical videos, subscribe our channel.